Okay, now I can see your screen, Bridgett.
Fantastic. Okay, thanks so much.
Mm-hmm.
Well, I'm so pleased to be here this afternoon to share my passion for research that improves children's lives. I'm currently in my third year of the doctoral nursing practice program at the university, on my way to becoming a nurse practitioner in family practice. Wow, that was a mouthful. I got to practice that some more before I graduate. So I want to begin today with a note of deep gratitude for my colleagues in the Seattle Public Schools Nurse Corps for their deep dedication to the health, well-being, and academic achievement of every child that we serve. And let's see if I can advance my slides. There we go. In response to new laws in states in the United States requiring vaccinations for school entry, the state of Washington included, nurses are now focused on protecting children from serious infectious diseases. A growing body of research demonstrates the effectiveness of a variety of strategies to move families out of vaccine hesitancy. Their knowledge of science, clinical expertise, and their knowledge of the family's values that they serve allows them to tailor approaches that are based on families' diverse needs. Nurses know how to turn up the heat to get results, and nurses are dedicated to caring for every child's well-being. The setting of my research is Seattle Public Schools, and it follows an immunization campaign that began last year following passage of laws requiring childhood vaccinations for preschool and school entry. Seattle Public Schools is the largest district in the state of Washington and has over 53,000 students in 104 schools, 155 languages and dialects spoken. About a fifth of our students speak a language other than English at home, and nearly 1/3 are eligible for free and reduced meals, which is a proxy value for financial resources of the family. So to understand the challenge facing Seattle Public Schools, let's view the global perspective. Why do we care about compliance? The literature is replete with estimates of millions of lives and many more millions of dollars saved each year by vaccines shown by exhaustive research to be overwhelmingly safe and effective, and in some cases, conferring a lifetime of protection from disease. Yet immunization in the US is declining. Why? Some cultures and religions prohibit medical intervention or the use of certain products, and some people have medical conditions that contraindicate vaccines. But the literature shows that the main reasons have to do with forgetting the toll that these diseases take, buying myths spread by fraudulent researchers, fears of governments and vaccine producers, and free riders who count on others vaccinating in sufficient numbers to keep them and their children safe. The result is that communities in the United States are losing immunity and outbreaks of vaccine preventable diseases are occurring. This map shows a lot of red in the Northwest, and we care about this certainly because of the loss of protection against vaccine preventable diseases, but for what it portends for our well-being in a global pandemic that is worsened by a rejection of science. Our state leaders have taken decisive action to reverse this dangerous trend of non-vaccination, using evidence-based strategies to increase community immunity, requiring vaccines for school attendance, limiting the use of non-medical exemptions, requiring licensed providers to give science-based patient education before signing exemptions, working at the local level to make vaccinating children easier, and most notably, locating services in schools. My research with SPS takes up where the initial immunization compliance effort left off, in which the school nurses brought student compliance up to 97%. And I want to say a brief word about compliance. That doesn't necessarily mean that children have received all of these vaccines. In most cases, it does. But there are a few number of children who don't receive the vaccinations, but supply exemptions that have been signed by a provider. So that's what compliance means. Basically, the child has medically verifiable records of the immunizations that they received, or we have a properly executed exemption on file. So Seattle Public Schools wants to evaluate the success of that initial immunization campaign and to study what we can do better. The problem that I'm looking at in my research is to go past that 97%, which is of course a stellar achievement, but we want to know more about that remaining 3%. This map shows Seattle Public School students who are at risk of exclusion in December of 2019. My research will examine if these clusters have changed, if out-of-compliance students share risk factors requiring different approaches, and to learn what nurses know about their experience in the campaign. My research is guided by the knowledge to action framework overall and by the phenomenological framework to shape the nurse survey. And this model is particularly well suited to an effort that is involving the end users at every stage of the research effort. It's iterative with the knowledge that's being grown and synthesized and turned into locally tailored tools and products. And it's a very egalitarian model. This model really shows the reality of how knowledge is generated. Good insights and information can come from anywhere in the community. So I'm going to be sharpening my pencils and analyzing student data to compare the entire student body with the out-of-compliance cohort, both before and after the 2019 law. I'll be studying the out-of-compliance cohorts with an eye toward demographic factors that might indicate a greater risk for being out of compliance. And some of them that have been supported in other research include homelessness status, immigrant status, foreign students who are here briefly, disability status, students and families who are English language learners, both low income and high income come with their risks. And we'll be looking at out of compliance by vaccination type and by exemption type. And finally, we're going to add in the expert opinion of people who carry out the work and have the insights into what was successful and what needs adjusting. Our national conversation now is aimed at pitting people against each other as monodimensional blocks of immigrant, migrant, lefty. But I wonder if it isn't more a tale of families who love their kids and are doing their best with what they've got. Is it a story of rational choices made by affluent families who've made the calculation that others have vaccinated in high enough numbers to make it unlikely that their kids will become infected and spread disease? Right alongside families who want their children protected vaccines but lack access to affordable clinics that are open when they can take their kids. Is this ultimately of the price of health inequities that are deeply embedded in our society? It's my profound hope that communicating my research findings, whatever they may be, will add insight into our efforts to protect children's health and to expand empathy for our human community. And I want to close with this amazing photo, which is an amazing event. The Seattle Public Schools Nurse Corps was recognized by the University of Washington last year in receiving the 2020 Martin Luther King Jr. Award for our outstanding community service. And I can tell you that was a highlight of many of our careers. So I thank you so much for your kind attention and welcome any questions or comments.